The first operation is the bypass, which has been around for a long period of time. It's been around for many years. It's changed in some ways because of the techniques and the technology and the advancement in that, which brings me to an important piece of the operation puzzle, and that is the operations have become more common in recent years. A couple reasons for that. The main reason is because many studies have shown the true benefit to the weight loss. We now know that the weight is what causes all those medical problems. So if we can get rid of the weight, we can improve health dramatically. The second reason, though, for the operations becoming more common is that over the years, and this even in the last 10 years, there's been a big change with laparoscopic or minimally invasive surgery to where the techniques and technology have brought us to the point where the operations are much different than even 10 years ago, and the safety or the risk profile of the operations is much less than what they were even just 10 years ago. 10 years ago, it was not uncommon to have an operation like a gastric bypass with a big incision and be in the hospital for a week. Of course, if any other problem set in like pneumonia or any other thing, you could be in the hospital for an even longer period of time. To where now, a lot of the operations that we perform now are done as an outpatient. You're not admitted at all. With the band surgery, a lot of patients can have surgery, go home the same day. Even with the gastric bypass, depending on the program that you're at, the bypass and the other operation we'll talk about, the sleeve, the majority of patients will stay the night and go home the next day. So, still major operations, and we're going to talk about what's involved with them, but certainly a big advancement from just even 10 years ago. It's like comparing day and night to the surgeries even 10 years ago. So let's talk about the operations. With the gastric bypass, and I'm going to show you a video, and these are animated, so they're not real. You don't need to feel too grossed out about them, but this is an animated video. The old way that we used to do the operations was with the big incision. We don't do that anymore. Now we do these little incisions, what's called laparoscopy, minimally invasive surgery. There's many different terms for it, but we're essentially using specialized instruments to do the operation and seeing it on a TV monitor. Inside, what's important inside is our stomach, which is about the size of a small football when distended. With gastric bypass, we physically decrease the size of the stomach. So when I said earlier that we reduce the size of the stomach, with gastric bypass, I really mean it. We physically divide the upper part of the stomach and create a stomach at the top that's about the size of an egg. So we go from a small football size to about the size of an egg. Now, in order for food to get through the system, we need to disconnect the intestine, bring up a piece of the intestine and hook it to that new small stomach so that when someone now eats food, it comes in through their esophagus, down into the small stomach, fills that stomach, signal goes back to the brain that says you've had enough, the satiety, and then the food goes through the rest of the system. Interestingly enough, a very common question is, what happens to the other part of the stomach? We leave it there. It's still alive, it has blood supply, it just doesn't have any food going into it, but it still makes fluid, it's reconnected back into the system, so that fluid goes through the system, and it still makes enzymes and things like that that we need, so we leave that stomach in there, it just doesn't have any food going into it. A couple interesting points, and very important to point out for you to understand, well, it's easier to see it than to just describe it, but in the other part, in the bottom part of the stomach is where we digest certain vitamins, vitamin B1, B12, and iron. After having gastric bypass, it's important for someone to take a multivitamin with B12 and iron because it's not going in through the stomach anymore, and so we need more throughout the body in order to get those levels. If someone takes their vitamins, very low incidence of having any problems with deficiency with vitamins that would require any kind of shots, but it is important to take your vitamins. Okay? The second thing with bypass is that there is a condition, and it's a syndrome, and it's called dumping syndrome. So dumping syndrome, there's kind of not a lot I can say positive about dumping syndrome. I mean, the name kind of speaks for itself. But our bodies normally process certain foods, and that certain food happens to be sugar, processed sugar, so candy, sweets, chocolate, in the stomach. Well, there's not much of a stomach anymore, so that sweet or that sugar comes directly into the small stomach and right into the intestine. The intestine is not used to seeing that, and it kind of fights back. There's a hormone reaction referred to as dumping syndrome where it causes severe abdominal cramping, nausea, vomiting, diarrhea. Pretty unpleasant, and it can last for 4 to 6 hours, so it's pretty unpleasant. So it seems like a pretty bad thing, but in reality, it's actually very beneficial because I guarantee you the treat is not worth the symptoms. So it really helps some people to stay away from that kind of food. Now, typically, and in general, the other two operations I'm going to talk about don't have that same reaction of dumping syndrome, but it is beneficial, so we like to just pretend like they do because it's not. Sugar is really just empty calories. Those calories are going to be stored right into fat. So we want to, as best we can, avoid those types of food.